are there any specific, issues in, women's health and, pediatrics that you're most passionate about?
Yeah, I would say childhood obesity really got me in med school. Like just seeing, I would say overall preventative care in
Yeah.
both arenas, because there's a lot of things that I see in kids that could have been prevented. And I always say it starts with the parents, kind of educating the parents and patient education. That's a huge thing. Educating parents because, sometimes I have kids come in who weigh more than me and they're like 10 years old. And so talking to the parents like, oh, I don't have time, or I just buy them what I can find on the street. Oh, I didn't know that was unhealthy and stuff like that. So I find that's one thing that drew me, because I felt like kind of getting them while they're young. That's what I used to say. Get them while they're young, because once you get them while they're young, you can build those healthy habits as they get older. So that's one thing that really drew me to peds, childhood obesity, other illnesses that can really be prevented from childhood. I see people in their 20s with diabetes, and not type 1, but type 2, which, we know that's acquired somehow with environment, food, and all kind of stuff, weight. So, I wanted to do that. But with women's health particularly, I like women's health because I talk about STDs a lot in this area because we see a lot of it. And just overall women's health too. Just talking to them about, again, more like primary care stuff, preventative stuff, how to take care of themselves. Breast exams, doing all your screenings, pap smears. A lot of people don't understand how important pap smears are. So I talk to women a lot about that. So those are the things that is a lot of preventative care for me, a lot of screening and things that you can do to catch things early or prevent things from happening. So I love both of those, but I don't know. I like kids, and then I found that I really like OBGYN. So there's a lot. It's hard to answer that question because there's so much about both that I like, but a lot of it like evolves around like preventative care type stuff. So
yeah,
that's the kind of stuff I really like. Yeah.
What does it look like for you if you do have that person who's 10 years old and like obese? What sort of interventions can you help state for, like them and their parents?
Yeah, a lot of time for me, it starts with education. So I actually have this printout that I give to my adult patients, but sometimes I give it to parents as well for their kids. Is a printout of like diet things that you can change, lifestyle modifications. So particularly with diet, so things you can cut out, more grains, more vegetables, more fruits. So it's like a long list of things to try. And I like it because it's not telling you do this, do that, do that. It's like, try this, think about things you can try. So people are more, what's the word, like willing to look at it, because it's not like me giving them this like rule book, like you need to do this. Like
right.
I'm like, just look at it. I'm like, number 1 has some things you can try. Number 2 has some things you can try. I just looked at it and like try a few of them. And if you like more, try more, So I tell them to do that. And then I think now, we knew this was a problem when we were growing up. I'm sure me and you're around the same age, but it's more of a problem now because of COVID, social media, kids on their phones, tablets, phones, TV. I mean, people don't go out as much as like maybe we used to when we were younger. I just remember like always riding my bike, being outside, playing all the time. Yeah. And we know like in med school, that's when I really started hearing about the childhood obesity. Like, Michelle Obama did this whole campaign thing back then. With kids not spending much time outside. I'm like, how much screen time are they getting? And most parents are honest, they're like too much. Like have a certain time during the day, like use your phone from this time to this time and that's it. Encourage them to go out and play if it's safe. And I always add if it's safe because some people don't live in safe neighborhoods. So and I ask the kid too, like if they're old enough, I ask them, what do you like to do? Do you like to play soccer? Do you like to kick ball? Do you like to play basketball? Do you like to jump? Do you like to dance? A lot of people don't know dancing is a way to act.
It's one of the best exercises.
It's one of the best exercises. And every time I tell them that, they're like, really? I'm like, yes. I'm like, dance for an hour, like actually dance. I was like, and one good thing about COVID is that, a lot of people, once gyms shut down, a lot of like people started posting things on YouTube, like, all these exercise gurus started posting their own videos. So I tell people, I'm like, literally just Google like Zumba classes, Afro beats, any kind of dance exercise. And there would be so much like instruction videos that pop up like for an hour, some of them 30 minutes. And I was like, just do it as a family. And a lot of times that gets them. I'm like, do it as a family, do it with your kids. And so the parents and the kids will do it. And then, they'll be active together. So I always like give them those tips because they don't think about that. They always think they have to put on shoes and go for a mile run. I'm like, I don't like running. Like, so dance. jump rope, do something, some kind of physical activity that gets your body moving, and that encourages a lot of them. So I like doing that because it's so important to me to just keep your body healthy, and we all know that all of us in the medical field know the importance of keeping your body healthy. So when you get them while they're young and the parents are involved, I feel like it's a whole family thing and they can do it as a family activity. And one of them came back to me and she was like, her daughter and her started like eating smoothies too, like drinking smoothies. So now they replace one of their meals with smoothies and they're both like doing like Zumba type stuff together online. So I'm like, I'll see them back in like 3 months and they'll be like, we lost weight. I'm like, yay.